My name is Matt Easter. I'm with the Cadmus Group, and we're working in partnership with Communicate Health to support CDC's National Center for Environmental Health and ATSDR. It's my pleasure to welcome you to today's webinar, Improving Community Health Through Land Reuse and Development. We are very excited and honored to have two speakers with us today. Laurel Berman, who is ATSDR National Brownfields Coordinator, and Leann, who's ATSDR Regional Representative for Region 4. We're very excited to have this webinar today, and the purpose of the webinar, and we're on slide number 6, is fourfold. One is to review the brownfields land reuse landscape and the public health's important role in the redevelopment process, to highlight the range of free resources that ATSDR has available to help you meet your redevelopment needs, to showcase some community projects that are underway or that have already happened that are improving health, and to describe actions that you can take to improve the health of your community. On slide number 7, you'll see the agenda for today's webinar. First, our speakers will provide an overall overview of the ATSDR Brownfields and Land Reuse Initiative. Then they'll talk about the role of public health in redevelopment projects. And then we'll spend some time discussing ATSDR's approach to these sites. And there's several factors that we'll touch on, including promoting the 10% Health Award, providing free tools and resources and what some of those are, showcasing a few models of success, supporting community health pilots, informing policymakers, and then we'll talk about actions that ATSDR is taking and some actions that you can take in your community, and then we'll try and leave some time at the end for an interactive question and answer session. On slide number 8, questions to consider. These are things that, as you're hearing the speakers talk today, these are things we'd like for you to keep in mind and think about how the information you're hearing might help you in advancing your own program and goals. So the types of things that you should listen for are, what did you hear about ATSDR's initiative that you want to learn more about? What tools and resources did you hear that you may already be using in your efforts? And maybe even more importantly, what tools and resources did you hear about that you didn't know about before and that you'd like to incorporate into your program? How could you engage your regional ATSDR representatives and help you include public health considerations into your projects? And finally, what are the 2 or 3 steps that you'll take as a result of this webinar? What is it that you're going to do with the information that you learned today? As you're listening to today's speakers, think about what are the couple things that you might do with this information to help you advance your program. So we'd like to start with a polling question. As I mentioned before, one of the ways we want to engage your familiarity with the topic is through polling questions. So on your screen, you'll see a polling question that's going to get at how familiar are you with the ATSDR Land Reuse Initiative. So you'll see 5 answer choices. Very familiar. I use their tools in all my projects. Somewhat familiar. I know what they offer, and we use some of their tools. Not very familiar. You know about it, but you don't use the resources. You're unfamiliar. This is your first introduction to the initiative, or not applicable. Hopefully no one's going to choose not applicable, but if you do, that's okay. And so folks can get a sense of how people voted. You'll see on your screen a bar graph showing how folks voted. So looks like a few of you are very familiar with the initiative. You use some of the tools in your project routinely. A good portion, about 21% of you are somewhat familiar. You're using some of the information and tools. About a third of you, not quite, are not all that familiar. And almost half of you are unfamiliar with the initiative. And that's great information to know. That way, our speakers, part of the reason we're doing this webinar is to really try and get this information out to folks. And so the fact that half of you aren't all that familiar with the initiative, that means this is a good reason to do this webinar. So thank you all for sharing that. And I'd like to follow up with one additional polling question. Obviously, ATSDR's focus, as you'll hear, is on public health in redevelopment projects. So we'd like to gauge for the folks on the phone, how important is public health in your project? If you are developing a site or you are involved in redevelopment projects, how important is public health in your projects? As you see, the answer choices: A, very important. It's critical for every project. B, it's important, and you try and at least consider public health. C, not very important. You know it's important, but you don't feel like you have the time, resources, or interest to address it. D, you don't think it's important. You rely on someone else to address that. Or E, because again, of the role that you play, it's just maybe this isn't applicable to you. So almost 60% say that public health is very important. It's a critical component of every project. That's great to hear, and I'm sure our speakers from ATSDR are smiling to hear that. 30% of you think it's important. You at least try and consider the public health aspects. A few small percentages, around 3%, you just don't feel like you've got the time, resources, or interest, or it maybe isn't applicable to your projects. And around 11% of you, because of the nature of the work you do, the public health side isn't applicable to your work. Thank you all very much. At this point, I would like to turn over our presentation to Leann Bing, the ATSDR Brownfields Regional Coordinator for Region 4. Leann?
Hi, this is Leann Bing. Who is ATSDR? The Agency for Toxic Substances and Disease Registry. I know that's a mouthful, so we usually just say ATSDR. We're a federal agency charged with preventing harmful exposures and diseases related to toxic substances. On the map on the right-hand corner, you can see we're in 10 offices. We're co-located with EPA. We also have an office in Alaska, in D.C., and in Whitney, Montana. We're in the country, in public health, one community at a time. Next slide. ATSDR helps people understand if there's a contaminated site and how it can affect their health and the health of their community. We can help you to determine if there's residual contaminant or physical hazards that are public health hazards or if they're not. We can make recommendations for you about what you can do to protect your health if contaminants are a health concern. We can help you work with the community to find out what the overall health issues, and we can help you work with the community to determine how redevelopment can address other health issues in your community. Next slide. Here's some of the ways that we can help you address your health concerns related directly to the site and to help you address your health disparities in the community by including health in your redevelopment. We have an arsenal of tools and training that is free, ranging from site tools to action model training, health education. We have videos and a leading change book for successful community health projects, such as the American College of Medical Toxicologists and the Pediatric Environmental Health Specialty Units. And we have cooperative agreements with state health departments, with local toxicologists and health assessors that could be in your state. And we have staff in all of our 10 regional offices and our other satellite offices, toxicologists, sanitarians, nurses, doctors, environmental health specialists, environmental engineers, and more. And you can contact us with that website of your screen at www.atsdr.landreview.gov. In addition to cleaning up the site to safe levels and preventing exposure to contaminants or physical hazards, that's kind of our main bread and butter. There's a few examples of some of the successes that communities have had in addressing health disparities. One of them was like redeveloping a brownfield to a health center to address health disparities in their areas. They did that with brownfield spending, with HRSA funding, and with the National Health Center Service Corps. Another ideal is redeveloping a landfill to a community park. Another one, we've seen installing a police station at a former gas station. Crime was reduced over 70% in that area. But other ways that, increasing economic opportunities, including, medical insurance, property values, adult education. There are many ways that you can use your brownfield sites to increase health in your area. Next slide. So why do you need health? Chances are health's going to be involved in some way or fashion, and you want to have them up front. For one thing, they're an unbiased partner. If there's any perceived contamination, but not really any contamination, they can help you reassure your community when there's not any health hazards. If there is real contamination, you want them there at your table to help you address the contamination, to make sure that any exposures are prevented. And they're just a resource to help improve the overall health of your community. They have all the tools for health education, risk communication, community involvement, health assessment. So getting your local health agency involved, your state health agency, or ATSDR is one way that, and in your community. Next slide. This is a map of all the places where we were engaged on formerly contaminated sites. The little red dots are our health assessment sites. The blue ones are community health projects at brownfield and land reuse sites. And the gray dots are all the other brownfield sites in the nation. Next slide.
Before we move on to the next slide, we want to ask another polling question. And before I ask that question, I wanted to do two things. One, apologies if folks are hearing beeps on the phone. It's as folks join the call late, it beeps them in. So hopefully most folks have joined at this point, and that will be kept to a minimum. So on your screen, you do see the next polling question. We're going to go ahead and open that. And this is several of you mentioned, a lot of you indicated that public health considerations are very important in your redevelopment projects. And so we want to get a sense of how many of you coordinate with your local health agency on redevelopment projects. So we'll go ahead and close that poll. And it looks like, when you see the results, it looks like about 40, not quite 40% of you do in fact coordinate with your local health agencies or departments on the redevelopment work that you do. About 12% no, 13% of you aren't sure. It may happen, it may not, you're not quite sure. And around 37%, again, because of the nature of what you do, it may just not be applicable. Thank you all for participating in that poll. We're going to move on to our next presenter slide, and I believe, Leann, that's you again.
Yes, that's me. So what is the role of public development projects? It's protecting and improving community health. Next slide. Communities, EPA, state and local agencies have requested our assistance in approximately 600 brownfield and land use sites. One way to help is through our health assessments. With the health assessments, we assess health impact of the site using the best science to determine if people are exposed, how they are exposed, and if the exposure is harmful to health now, in the past, or possibly in the future, depending on how the site is redeveloped. Assessment, we designate categories of health threats from no apparent threat at this time to those that are potentially a health threat. Out of these 600 sites, approximately 40% impose a public health hazard to individuals that could come in contact with residual contamination or the physical hazards that remain on the properties. So we strongly encourage you to have your local health agency involved with the residual contamination to see if the residual contamination at your site is a health threat. Next slide. All right, this is some of our worst case scenarios. On your left is a mercury vapor lamp factory in New Jersey that was converted to residences. There were pools of elemental mercury that were found in the building. The elemental mercury drops were identified in the 4th floor residential units, and the mercury was located on their stoves and on their countertop surfaces. The mercury was at a high enough level, and they were unable to get it down lower that the residents were urged to relocate as soon as possible. The building was declared an imminent health hazard and then condemned by the city. On your right is a picture of a child playing in the dirt. A child care center was redeveloped next to a child care center was redeveloped next to a dry cleaner. There were high levels of tetrachloroethylene. ATSDR recommended to inform the parents and the workers of the findings, conduct more samplings, locate the source of contamination into the child care center, and then eliminate exposure. That was the results from the health assessment. The Philadelphia Department of Health was engaged. The Philadelphia Department of Health instructed the dry cleaners to control their emissions in the dry cleaners and change their cleaning agents that they were using. Additionally, the City of Philadelphia passed an ordinance to enhance the protection of public health for establishments co-located with dry cleaning operations that include increased monitoring and corrective actions. Why did these happen? Not every redevelopment site has a loan or grant that requires a Phase 1 site assessment or any kind of site assessment, and not all site assessments are equal value. Sometimes the environmental site assessments do not address a community's concern about health risks with the residual contamination or the institutional controls, or identify all the public health hazard issues. If the public health issues are not identified in a contaminated site, there could be new exposures after redevelopment. Sometimes there's budget cuts. Public health can be and are involved in planning healthy communities successfully and improving community health overall. and they're seen as a credible source of information for communities. Unfortunately, in today's economic atmosphere, local, state, and health departments are underfunded and understaffed. So ATSDR is working with the health entities and the communities, preventing exposures and promoting overall community health. Next slide, please.
At this point, I'm going to turn the presentation over to our next speaker, Laurel Berman, who's the National Brownfields Coordinator. Laurel?
Yes, hello everyone. This is Laurel Berman. On my screen, the slide has just loaded, so I'm going to just pause for a moment and say that we're on slide 21. And I want to pick up from where Leann has left off, where Leann sort of provided a big picture about brownfields land reuse and the need for public health involvement. I want to point out first that when we talk about brownfields or land reuse sites, it's based on our experience with those 600 or so health consultations or assessments that we've performed over the years that's made us realize that when you have a brownfield site, which is a site that meets the EPA definition of a brownfield, or a land reuse site, which includes those EPA sites, but also any sites slated for reuse or redevelopment, the term most used by local health agencies is land use. So we try to tie to that land reuse term. But what we see in many of our communities that we have multiple land reuse sites, multiple brownfields, which can potentially have multiple impacts on the population. So we've developed a multi-pronged approach to address these multiple impacts. We have 6 basic steps that help us shape our program. We promote the 10% Health Award, which is a health monitoring award that is allocated within the Brownfields law to brownfield funding. We provide free tools and resources. We showcase models of success from across the U.S. We support community health pilots when we have funding available, or we provide in-kind assistance on these pilots. We inform policymakers. Things like the lowering of the blood lead level before primary intervention occurs, or school siting, daycare siting guidelines. And we promote action by taking next steps. Slide 22, I will address our first step, which is to promote the 10% Health Award. ATSDR worked with the EPA Brownfields program to include an allocation for 10% of a Brownfields grant, whether assessment or cleanup, that could be allocated for community health projects. The next slide. So we see on slide 23 a pictorial version of that 10% award. What we're encouraged about is we're starting to see more communities beginning to allocate funding for community health monitoring. That is the wording in the Brownfields law as community health projects associated with land reuse. So we're encouraged to see more projects starting, and we like to provide examples of these projects to encourage more to happen. Next slide.
Okay, the next slide is a polling question, and as Laurel just discussed, the 10% health monitoring in the assessment grants, we want to get a sense of are folks taking advantage of that? It looks like about 8% of you are taking advantage of that 10% award, which is great. I'm sure folks would love to see that number increase. 28% of you aren't. 25% of you aren't sure. That might be in terms of thinking about those action steps that you're going to take after this webinar. You might want to see if you can find out if you are or not, and if you're not, look into how you might do that. And for about 40% of you, again, because of the nature of the work you do, that's not applicable. Okay, thanks everybody, and we're going to go ahead and I'm going to turn it back over to Laurel. And again, if the slides take a few minutes to load, we do apologize for the delay.
Okay, thank you, Matt. We're on slide 25 now. Our second step in our multi-pronged approach is to provide free tools and resources. Over the past several years, we developed tools and resources for local health and for communities to engage in reuse decisions. And by communities, we mean what we call the development community. That's anybody that has a vested interest in the redevelopment of a particular area. So the community can range from a resident to a high school student, a college student, an urban planner, a developer, or an environmental consultant, as well as people in regulatory agencies. The next slide is slide 26. I will discuss one of our first resources that we have available. The full name of this is the ATSDR Brownfield's Land Revitalization Action Model. And we use the term revitalization because in a down economy, often there's not a lot of redevelopment money, but there is a lot of will towards revitalizing the community, which in turn can spur economic development. The action model is a way to establish a baseline of overall community health status in a community from a population of 200 people on up to 90,000 people. We've applied this in several projects across the country. It's a very, very flexible framework. It's a four-step framework. We call it the four-step action model. And it's grassroots, so it can be conducted at the community level, and it's designed to foster dialogue, communication, and vision among the diverse members of the development community, all those folks that have a vested interest in revitalization of an area. The action model creates a framework to assess the impacts of redevelopment on public health. And one of our goals is to achieve a positive, sustainable improvement in overall community health. And we make it measurable. The fourth step of this model is, can we measure change? Which is very important. We often do not have indicators of community health. Even in the brownfields realm, we do not have many indicators beyond number of jobs created, number of sites remediated, number of acres put back into productive reuse. So we begin to broaden what are the things that we can measure as redevelopment occurs. Projects from across the country are using the action model. Many are in the Midwest, where we have a very large percentage of reuse sites. We also have projects in Oregon and several in New York. And we hope that there will be projects in your communities as well. The next slide is slide 27. One of our second tools is called the ATSDR Brownfields Land Reuse Site Tool. This tool is a rapid site assessment and multiple chemical exposure dose calculating tool. So users of the tool can assess sites by past or future use, institutional controls in place, the proximity of sensitive populations, how often the site is accessed, and as you go through a series of questions and screen, it's very user-friendly. The site tool creates an inventory of the site, so records can be stored for public inquiry of the site. A developer may want to know what were the contamination issues on the site, and this is a good way to characterize and catalog site information, as well as assist in a rapid response to inquiries. We can also catalog institutional controls, history of spills, types of contamination, emergency response events, and also public health concerns that may have come in, for example, to the local health department. Included in the tool is a site visit. The last tab on the right side of the picture says site visit. I know it's small print, but it provides a checklist or a walkthrough for when you're looking at a site. And I think probably the greatest value that this has is it can be synced with other systems or modified to work with other systems such as working with GIS. One community we work with has integrated this with other databases. People can sort of have one-stop shopping to learn about their community. Another community has entered over 400 potential brownfield sites into the tool, which gives them a large picture of where the brownfields are and what some of the sites that might be priority are. Gary Perlman, who is likely on the call and is an integral member of this team, along with Leann and myself. Gary was the lead author on a paper about the site tool. Gary also created the tool. We like to joke that Gary creates it, Leann breaks it, and I promote it. That's pretty much how our team works. This article is coming out in the next issue of the Journal of Environmental Health in mid-November. The next slide, slide 28. Embedded in the site tool is what we call the multiple dose calculator. These screenshots are probably difficult for you to see, but what we see is that they are very simple to use. It's a drop-down menu. There are thousands of chemicals that can be queried in this. And the exposure dose calculator helps the user evaluate exposures by defining the exposed population, the exposure pathways. There can be multiple exposure pathways such as inhalation or dermal contact or ingestion. And it embeds standard and user-specified ingestion rates, sort of what we see in risk assessment. Doses can be calculated using different ranges of exposure parameters. 95% upper confidence limits, for example, or the geometric mean, and the data can be tested for distribution in terms of normal or log normal distributions. The take-home message here is that we can look at exposure pathways and calculate exposure doses very rapidly. So if you have a licensed environmental professional working on your brownfield site, a risk assessor that's out in the field visiting the site, and you have some sampling information, it can be input into the dose calculator and very rapidly, let's say it's a site that's next to a schoolyard and kids are playing there for an hour every day and they're 7 years old on average, we know the average body weight, and very rapidly you can assess that site for the chemicals of concern in terms of the risk to the people accessing the site. It is not a substitute for risk assessment, but it's a good screening level calculation that can help prioritize how we address a site. The next slide, please. Another resource that we've developed, it's probably one of the most fun projects that we have for us, is that we create community health videos. And they're very professional commercial quality videos created by our videographer, Robert Safe, who's the director in Region 4 office where Leann works. But we try to showcase where projects have been very successful in integrating health and redevelopment and use these short videos that are 10, 15 minutes to provide guidance for other communities. They can be very motivating. We cover things like healing tribal lands, Baraboo, Wisconsin, Ringling Riverfront redevelopment in a smaller community. And at the lower right, you see Postville, Iowa. This is a very interesting project in which across 5 counties, a curriculum was developed for preschool teachers to address lead exposures among children and try to reduce those exposures. And this is a companion video that accompanies that curriculum. And these are all available on our webpage as well. On our next slide, this is a project that we are still developing, but it's very close to being completed. We interviewed local health agencies about some of our tools and resources several years ago. And one of the resources that they felt was very needed was health education for local health departments and environmental agencies. And so we have the basic components of environmental health education, which is what is toxicology, learning about risk communication and risk assessment, basics of epidemiology, and the use of GIS in land reuse and assessing hazardous waste sites. We hope to distribute this training broadly, not just to local health agencies, but also to environmental agencies to distribute to their grantees or their communities that they work with, especially in areas where the local health department may only be 1 or 2 people on staff. This can help them take on what could be perceived as an additional burden in addition to beach sanitation and swimming pool sanitation, which keeps and disease outbreaks. We're now expecting local health agencies to work on land reuse issues. And as Leann said earlier, why do this? Because they will probably be pulled into it anyhow. So we'd like to give them the resources and tools to be prepared. Next slide.
Okay, we're going to ask another polling question. We're going to open up the poll in a second. And this is really, as Laurel just discussed, there are a number of resources that ATSDR makes available to assist with these projects. And Laurel went through them all quickly, and I know there's a rich amount of materials that are on the website and available that you all can get access to. So we're curious to see if folks use any of these tools and resources in your projects currently, and which ones. So we'll take a few minutes, and if you could just select the choices that correspond to tools and resources that you may be using, we'd love to see that. So it looks like about 20% of you are using the action model. About 26% are using either the site tool or the dose calculator. Almost 20% of you have used or are familiar with the community health videos. About 8% of you, the Leading Change booklet, and 27% are accessing some of the health education services that Laurel described. So that's phenomenal. Hopefully, as a result of this webinar and Laurel and Leann's presentations, you have a better sense of some of these tools and resources and how they might help your program. So hopefully if we were to do this webinar in a couple more weeks and ask folks the same question, we'd be seeing closer to 100% for all those different tools and resources. But it's nice to see that folks are familiar with these and are using them. So we're going to turn it back over to Laurel.
All right. Our third step in our multi-pronged approach is to showcase models of success. Next slide. Now, we tweeted a little because the polling question asked if you were using the Reading Change book. Because it is a resource, it's also one way we do showcase the very successful community projects. This was our first book. We are now working on book 2 and book 3. And along with our videos, this is a way to show success stories that show redevelopment where a variety of health-related goals have been obtained, whether it's increasing recreation or green space, affordable housing, access to health care, community policy, community policing, education, revitalization of tribal lands, how jobs have been created, schools in very dense urban areas that have been very innovative. So we'd like to showcase how these communities have been successful. And also we include lessons learned so that when other communities look for guidance, they can emulate hopefully the positive parts and also learn from the lessons learned and not have to reinvent those. And this, again, is also available for download from our webpage. On the next slide, our fourth step is to promote to support and promote community health pilots. The next slide, please. To date, we have funded, and when we talk funding, we have much less money than the EPA Brownfields program does. I want to be very, very honest about that, but we do a lot of in-kind work, and we've also been able to fund at varying levels from probably as little as $20,000 or $30,000 on up to $150,000. Now, 23 different community health projects that are related to land reuse and public health. Primarily, the funding has gone to local and state health agencies, but cities are encouraged and locals are encouraged to be involved, to be part of the brownfield process. And you can also, we've also seen one of our communities where the local health agency was involved. They applied for brownfield funding, and they said had they not been involved in a project, they would not have done that. So we support through funding. We also support through in-kind assistance. We frequently work with EPA brownfield grantees to help address some of the health issues on site. Next slide, please. One of the projects we supported was in Baraboo, Wisconsin, which is about 45 miles northwest of Madison, Wisconsin. It's a smaller city of a population of about 12,000. And I'll give this as a case example. As one of the communities that did use the action model, they were very active. We had first launched our action model in Milwaukee's 30th Street corridor, which had a population of 90,000 people, was a dense urban area, and was described as an underutilized and underserved area with a large population of children with blood lead poisoning. I think up to 16% of the kids had blood lead poisoning or elevated blood lead levels, loss of jobs, poor housing stock, a lot of foreclosures. And then we used the same model, the action model, in Baraboo, Wisconsin to see if the model could be used in a different scale and under much different conditions. You know, this is more of an idyllic, smaller town, very environmentally focused. And what we found is the model was successful and could be used and now has been used across the country. But since Baraboo was our second project, what we found was the community developed 33 different measures of community health status. And as we worked with the community, we found that very rapidly, within 1 to 2 years, we could measure positive changes in about 1/3 of those 33 measurement indicators. These included the relocation of the waste transfer facility that you see on the upper left. This was the Veolia waste transfer facility. The facility was actually removed, dismantled, demolitioned, and relocated off of the riverfront where there were concerns about leachate and rodent problem, and one of the greatest concerns was odor. This was in a tourist area and also very close to a daycare center, and there were a lot of odors associated with the garbage that was stored on site. That has since been relocated. If you look to the right, there's a gazebo. What's in front of it is That was one of the main stormwater outfalls into the Baraboo River from the surrounding neighborhood, also very close to this waste transfer facility. Volunteers built a biofiltration pond. One of the volunteers is an engineer, and he learned how to build a biofiltration pond, which they filled with 700 native species to trap pollutants in stormwater before they can enter the Baraboo River. So they're overall improving water quality.
Okay, the next slide, please.
Yeah, it's just taking a second for it to load, Leann.
Okay.
Yes, it's our fifth step of our multi-pronged approach is to inform policymakers.
Okay, some of the things we've been working with our partners on, such as ATSDR Region 1, is collaborated with EPA to develop the National School Siting Guidelines. These are voluntary school siting guidelines that can help school districts and community members evaluate the environmental factors to make the best possible school siting decisions. Tara Summers up in Region 1 has also collaborated with various people on the guidelines for daycare siting too, which do not have the same kind of licensing requirements as schools do. They do have some licensing requirements, including like the health and safety of the facility, to look out for hazardous conditions and practices, but they don't require environmental assessment of the child care center or to prevent the center from being placed on or next to a contaminated building. Tara Summers in Connecticut have worked very hard on developing a safer daycare siting policy, and Connecticut has a child daycare screening assessment and environmental risk program. There's also urban gardening engagement project, and this was in the Philadelphia Soil Kitchen. This was part of the Brownfield 2011 conference, and it's a collaboration with the EPA, and the project ran for the 6 days. And what they did is they had people that could bring in their soil to be analyzed. They were given free soup. They were given informational sessions. And EPA analyzed for lead cadmium at the same time. Another partnership we have is with the lead exposures, which Laurel talked about earlier, with the Upper Explorer Land Planning Commission, Regional Planning Commission, that they the curriculum for their preschool teachers. Next slide.
The last step in our multi-pronged approach is to promote action and to take next steps so that we continue to grow. Next slide, please. We'll go through some quick examples of how we do this. One of our very active projects is an environmental justice land revitalization project in Detroit, Michigan. This was an in-kind project. Everybody involved has provided in-kind assistance. They do not have formal brownfields funding or funding from ATSDR. The community in Southwest Detroit focused on using the action model as a resource guide to highlight the many positive efforts that various members of the community and the development community are taking to improve community health. Actions that came out have been several health fairs to assist with childhood and other types of childhood-led screening and other types of health screening. They've collaborated with Wayne State University. They've been able to, EPA has helped enhance available maps of industries and businesses in 48217, so has the City of Detroit. And they mapped 6 surrounding zip code areas. Bilingual fact sheets tailored to a particular zip code on the Rouge River about fish consumption have been developed. The action model was incorporated into an environmental justice initiative. There was a very large conference hosted by Wayne State University that was, it was called Know Your Rights. And basically that was a lead exposure outreach and education conference to explain why enforcement is being taken against landlords in Detroit if they're not having lead health risk assessments done on their properties when they are renting to families with small children. So very, very interesting project. And we have a very large multi-agency collaboration that's working together with the community. So it's been very successful. Next slide, please.
This next slide is about from our Leading Change book, and it's highlighting the success story in Clearwater, Florida. The picture on the top, on the right left-hand side, is an abandoned gas station, which was once a haven for drug deals and other crimes. A homeowners group, South Clearwater Citizens for Progressive Action, took this to gain control of the property for the neighborhood. Using a neighborhood grant from HUD, residents, government agencies, and the private sector worked together to transform this drug to the South Greenwood Neighborhood Police Station. Next slide. This is another example in Clearwater, Florida. This Clearwater Neighborhood Housing Services acquired this complex and renovated it for low-income tenants. This $14 million project was financed through bonds, loans, tax credit, equity, development fees, and grants, including a brownfield grant. Over the 14 months, asbestos were remediated and interiors and exteriors were completely remodeled. One key to success was their partnerships. The Bank of America funded a Make a Difference Center at the apartments with a computer lab, a library, a playground, and laundry facilities. This is just another example of some of the success stories that are in our Leading Change book. Next slide.
Now, we've talked about the Baraboo, Wisconsin Action Model Project as one of our case examples in the companion video that we have about the project. But I want to show some of the changes that rapidly occurred in Baraboo and to stress the importance of doing what's important to the community. What was important to this community was environmental conservation, especially at the Baraboo River. During the project in June 2008, there was a record flood. Many people lost their homes. This recreational trail that you see in the upper left was very damaged. It was still under development at that time and went through a lot of damage during the storm. Below, you see 2 years later, the city immediately began to repair the trail within weeks of the aftermath of this storm and responded to community concerns that came out in the action model where people said we need a place to walk our dogs, we need dog waste receptacles, which you see here on the left. They added more places to sit, and by doing surveillance of the trail could actually show that more people of various ages were using the trail, more people were using the parks that were connected to the trail. And they were very successful in also building a dog park adjacent to the trail. On the next slide, you see some of the additional changes that occurred very rapidly. We discussed the waste transfer facility before, but this is sort of a quick snapshot from standing building in the matter of 1 week to only left were dumpsters, and then it was an open lot, which is now an alfalfa field. While they're waiting for a green developer, they have an ordinance for green development in the new redevelopment area. While waiting for the perfect developer to come in, the city planted alfalfa on this site, which is used to feed local livestock. So they have a sustainable interim use. Below is the continued remediation of the manufactured gas plant. Alliance Energy is now on the site. Eventually, it will be a part of that area will be a mixture of housing. What you're looking at in the middle is a transformer storage yard, which was completely remediated, removed. There were no PCB issues associated with the site, which was one of the concerns. And you see the ongoing remediation on the lower right. On the next slide, how we continue to promote action. And our next steps is we've recently developed a steering committee. This is a group of national experts from different areas such as urban planning, food policy, food systems, different academics, probably some of the people on this call, we're partnering with technical assistance to brownfields, public health officials, local health agencies, EPA, community outreach professionals, and professionals in economic development, among others, to help us shape our work over the next several years and help us grow bigger so that we can share not only the expertise of our national experts, but also reach out to more communities. Next slide, please. We wanted to, while this has been a blitz attack on what we do in brownfields and land reuse, we also want to highlight some actions you can take. Please visit our webpage, download our free resources. There is a contact email there for our land reuse team, Laurel, Leann, and Gary. Feel free to contact us.
You can also contact any of our regional reps on the ATSDR website. They have all their contact information. You can engage your state and your local health departments in the planning process.
We encourage you to adopt the action model for your projects. We'll help you with this. As a matter of fact, we support our resources. Matt, I think the next is you.
Yes, the next is me. We have one final very quick slide, or polling question we want to ask, and then we do want to leave, some time for question and answers. We have had some questions coming in over the chat feature. So really quickly, as you've been thinking about the webinar and thinking about sort of the information you've heard, but want to get a sense of kind of what actions people may plan to take now that they've participated in this webinar. So if you could just take a few minutes and quickly respond. Again, you can select more than one choice. Okay, let's go ahead and we're going to close it. So this is phenomenal. it sounds like just about everybody, 86%, which is a pretty large number, are going to download and use the materials that were discussed today and available on the website. So that's fantastic. About a third of folks are going to contact their regional representatives. Just less than a third are going to reach out to their state or local health departments to engage them. And again, just about less than a third are going to adopt the action model for your projects. And then around 14% are going to do some other things. So that's really great to hear. So as we have been talking, lots of questions have come in over the question and answer pane. And so we will take a few minutes to try and answer at least a few of those questions. And again, if you do have a question you'd like to ask, if you can just use that question pane, type your question, and it will pop up here on our screen. And so a couple of the questions that come in, and Laurel and Leann, I'll let you decide who wants to answer these. So one question folks had is, do measures of community health include walkability, bikeability, connectivity, access and transportation, as well as things like toxicity, contamination, et cetera, et cetera? And the genesis of this question is, with the obesity and diabetes epidemic, makes the built environment's consideration is equally important as things like chemical toxicity. So are those other factors included in some of the measures of community health?
Yes, 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 and yes. Absolutely. This is what communities come up with. They want their walk score, for example. They want to know how connected their sidewalks are to all over their cities. Can they walk everywhere? How many parks are there? What is the percentage of green space? How many people use the park? So these are definitely considered public health measures, along with more traditional health measures such as asthma and toxicity and pollution.
Leann, anything you want to add? Or?
No, I disagree with Laurel. Yes, this is included in each community is unique, and they choose their own health indicators.
Okay. Someone is asking, who's the intended user for the site tool?
Any of us could answer that. We created this for local health agencies to help engage them more in land use and reuse because they're usually the first stop. People say, what's the phase one on this? And it's usually maintained by the local health agency. But we encourage brownfield grantees, especially to use it to develop their site inventory. It's free. It can save a lot of money that can go into site assessment because it's very easy to use and we support it. Gary Perlman gives webinars on the tool. It also comes with its own tutorial. So anybody that really wants to get a handle on the overall world of what sites are in my community can use the site tool.
Great. Thank you. And quick question, I think this is probably the easy one to answer. Folks are wondering, are these tools available to the public for download or for availability?
The tools are available. They're not available for download because we're not allowed to put them on our website, but all you have to do is send an email to the ATSDR.landreuse@cdc.gov, and I will be happy to send you a copy of the tools.
The videos, the leading change book, the action model examples are completely free and downloadable. It's just the site tool has a platform that we need to nail out.
A couple questions have come in surrounding the grant funding. So one is, can funds be allocated for community health projects if it's not specified in an existing grant? And if so, how does that work?
Can you repeat that? I'm sorry. So can funds be
allocated for health projects if it's not specified in an existing grant? As opposed to, I guess,
actually, we try to maintain very good relationships with brownfields coordinators at EPA. So let's say somebody has an existing brownfields grant and a problem comes up or an issue comes up. We've actually had EPA project officers, project managers on brownfields grants say, why don't we readjust your budget and look at health monitoring? A direct example was a town that was an unincorporated village, I guess would be the township, that was concerned about their drinking water. People actually were not using their drinking water because they thought it was contaminated. And they ended up getting some other pockets of funding from the state. But the EPA project manager had ATSDR consult on this situation, and they did end up testing the tap, which was where they were getting their groundwater, was their potable water, and it turned out there was not an issue. There was not a contamination issue. So you could avoid a lot of problems that way. So it was very worthwhile. So yes, you can go back in. We have seen that happen with the EPA Brownfields program. And I should not speak for EPA, but yes, that can be done.
And another question kind of related to funding, at what point in the brownfields process would you encourage a local health department to apply for an ATSDR brownfields land reuse and redevelopment grant? At what point in the process would you encourage a local health department to apply for that grant funding?
They can apply for it at any point in the process, whether the beginning, the middle, or the end.
There could be an established community group that's working on different issues, for example, and the project could be well underway that needs some, would be great if they had a little funding so they could do more. There's an example. Or it could be just at the beginning stages where they're thinking about building capacity in the community and working with the community on, let's say, a landfill that's being redeveloped.
And someone's asking, and this may be, I don't know if you know the answer, but how many of the ATSDR brownfield grants are going to be available for 2013?
Normally we have between 2 and 4. It just depends on the budget year.
Understandable. And then another question, and this actually 2 more questions, and I think we'll probably need to stop. One, someone's asking if on the steering committee, Laurel, that you discussed, is there tribal representation on the steering committee?
Yes, there is. And we welcome additional tribal representation.
So I think for our last question, this is a question that's a little more specific to Baraboo, but I think it might be interesting more generally. So some of that, can you talk about how Baraboo leveraged funding for activities like demolishing the Leah site or installing the bioswale? Who coordinated and oversaw the work on such activities? Was it the local health department?
The local health department was not part of the demolition. Their project was they did a visual site assessment of all of the properties in the redevelopment area and assessed them in terms of lead risks or asbestos, which was a tremendous project. In Baraboo, they had brownfield funding for assessment. They probably had, I don't know where their demolition funding came from. It might have been a cleanup grant. But the bioswale, the biofiltration pond, was a volunteer effort. And that is something I really, really want to emphasize is there's a lot you can do with a little bit of community will. Sometimes some of the major, I don't want to name a store, but you can get seedlings, for example. If for a project like this, if you just ask, there's photographs we have of the community just getting out there and creating that biofiltration pond.
Thanks. And then the last question that came in, I think kind of feeds into the next and final slide. Someone's asking if people are interested in joining the steering committee or just being, kind of in the loop on what's going on, how might they do that? And I'm assuming it's going to be to contact one of you, so I'm going to bring up the last slide.
Contact me. And our steering committee is large, but we welcome as many people as we can fit, or we can do separate updates and have sort of a I don't mind having a subcommittee. I think would be great so that we can get this information out to people. The first step will be to upgrade our webpage to include the description of the steering committee and what we're working on.
And one final thought before we do wrap up. A couple folks have asked, is this information, is the webinar content going to be available after the webinar? And the answer to that is yes. We will make available the slides and some of the materials that were talked about today through the ATSDR Brownfields and Land Reuse Initiative website. That will take a little time to get the information up there, but it will definitely be made available if folks want to view it, or if you know people that weren't able to participate today and you think would benefit from listening to this, and hopefully that is a step that folks will take, is to pass this information along. It will be available through the ATSDR website. So at this point, I would like to thank our speakers, Laurel Berman and Leann. They've done a phenomenal job today of giving us a great overview of the program, the initiatives. Many of the resources are available. We appreciate everyone participating in today's webinar. If folks do want to stay on for a few minutes, we will leave the presentation pane open. So if you do have additional questions that you want to send us, we can certainly follow up with you on answers to those, or if you have any feedback on the webinar, you certainly can put it into the pane. And again, thank you all for participating today.